I am Councillor Jimmy Brooks, Chairman of this committee, and sitting to my right is the Vice Chair, Councillor Maggie Cullen. In addition to welcoming the members of the committee, I would also like to welcome Councillor, where is he? Oh, he's at the back. Councillor Steve Clegg, Executive Councillor for Adult Care and Health. No Councillor Locke today, I'm assuming? No, thank you very much. Before we begin the meeting, there's the standard announcements. If there is a fire alarm, please head out through the rear doors into the reception and into the car park and await further instructions. The audio-visual feed of this formal public meeting is being broadcast live via the County Council's website, and all your comments will remain accessible online. Please have all mobiles, laptops and tablets on silent mode, and the hearing loop is now activated. Requests to speak will be collated by the top table. Please indicate early if you wish to speak. We will now move on to the formal agenda. Agenda item 1, apologies for absence and replacement members. Jess.
None received, Chairman.
Thank you, Jess. Agenda item 2, declarations of member interest. Do we have any members wishing to declare an interest? No. Thank you very much. Agenda item 3, minutes of the Adult Care and Public Health Scrutiny Committee meeting held on the 29th of April. This item is to approve and sign the minutes of the last meeting as a correct record and of the previous meeting. Please turn to page 5 to 8 of the agenda pack. Do we have any questions or amendments? No. Councillor Woolley.
Starting as I mean to go on, Chairman.
Fine, thank you very much.
Chairman, it is a general point, and I completely accept what was put. But on page 7, which is an under resolved for the short breaks and recommissioning plan, point 1 says that the committee supports the recommendation to the executive, and yes, the majority of the committee did support the recommendation, but not all of the committee supported the recommendation. And I think that probably, I do know that, well, I say as by default, I've had so many emails from residents affected by this particular issue, and I do wonder that they have no way of knowing who supported the recommendation and who didn't support the recommendation. I accept that this is a democratic services point of view, but or view, but I do wonder whether there's scope or room to be able to, change the wording slightly.
Yep, just bear with me. Jess. Yeah, you go through it.
Thank you, Councillor Woolley. So as far as the comments made by the committee in that meeting, positive and negative, they would have been summarised in the scrutiny comments going to the executive for their consideration. And they're also published with the agenda for the executive, so there will be a public record of all the comments raised.
If I may, Chairman, I don't really think that's what I was getting at. I just think that the what was resolved, that statement is too narrow, that it implies, how it's worded implies that the whole committee agreed with the paper.
Yeah. Let me just bring in Chiara.
Hello, thank you very much for this point raised. Just to clarify, on statements that summarise the committee's views, if the committee has supported the recommendations of a pre-decision scrutiny item collectively, then it would be reflected as unanimously supported. Members are not identified as to whether they voted in favour or not. There is a record of how many have voted for and against, but it's not a vote by name. You can request when the vote is taken that you wish for your name to be captured in the meeting minutes as voting this way or that way. So you can request for that to happen, but we don't do a vote by calling of names unless it is requested, it's raised as a proposal and it's voted for. So thank you.
Thank you very much. I think that's the best way forward, Councillor Woolley. If you request your name to be noted, I think that's the way forward. Councillor Overton.
Thank you very much. The point I think that I wanted to say is that sometimes the recommendations are put together. So you may well, I did want to, my comments to be put forward to the executive. That was one of the recommendations, that our comments should be put forward, but not support the proposal to close Swallow Lodge and Cedar House. So I think it might be a question of us, when we put the vote, separating those out.
Yeah,
Thank
I think what we're going to do is, if you want your name to be captured, please request your name be captured, and the officers will capture that. Chiara.
Just to clarify, what you're actually voting for when you're considering a pre-decision item is on whether you wish for your comments to be shared with the executive or the decision maker, and whether you support the recommendations as they are in the report, and that goes as one. Now, if you have any alternatives that you wish to be proposing, these will not be voted on separately, but they will be captured separately in the structure of the set of statement that will reflect that some members requested for this amendment to be considered, or this alternative to be considered. So we will always reflect exactly what members have stated, what they have requested, and what they are suggesting to the decision makers. If you wish for us to make it more explicit, all you need to do is just request it at the point of consideration.
Thank you. I'm requesting it in future. Can we always please separate out, can we have our comments put forward to the executive to anything else, and not lump it in? Because how can we possibly vote against having our comments put forward to the executive, and yet you lump it in with closure of the Swallow Lodge? It's not acceptable. We have to have them separated out. And
Thank you very much, Councillor Overton. We are seeing if this is a correct record. Councillor Lee.
Thanks. I knew it wouldn't last long not saying anything.
I know.
This has happened to me before, and I have to say, under the last administration when Hugo was chair, and it was actually on housing-related support. And I think it would not be problematical here to include just a sentence saying a number of members were not satisfied, or however you put that, a number of members didn't agree with this. But what I've always done, as someone who's been around like 20-odd years, when it comes to the vote, I put my hand up and say, I would like it noted, for the record, Councillor Lee said A, B, C and D, and that way it's separated out. But I don't think a block thing, because people don't look at the minutiae generally, and I do think you need an extra sentence in there saying, several members did not agree with this. It was not a unanimous decision.
Thank you very much for that, Councillor Lee. Yeah, we'll go for that way forward. And also, just remember, it is actually captured live on the internet, and you can look at it at YouTube and whenever you wish. Councillor Woolley.
A small point. You're absolutely right, Chairman, but interestingly, the way that people vote or put their hands up, that bit isn't captured, because often the camera is on you asking.
I fully understand that. What I normally do is, say if I'm just commenting on something as a member of the committee, I would say I fully support these recommendations, then the camera's on me and it captures me as well. So thank you very much for that. Do we have any more questions? Councillor Reeve.
Thank you. I also received a deluge of emails following the last meeting regarding the closure of Swallow Lodge and Cedar House, which is why at the full council I asked a specific question as to how they're going to proceed forward, and it gave our executive councillor full opportunity to explain the position and explain that there is more consultation going to be taking place, and that people will be consulted more directly rather than as an add-on to existing emails, etc. So I think majority of people are now quite happy that they are being listened to, and views are being taken into consideration. Thank you.
Thank you very much. Is there any questions on the accuracy of the minutes?
Sorry to continue, but there was a question, a comment put forward about for an amendment to the minutes to just put that extra sentence in, and I don't know if that's just been accepted or if we need to vote on it. Thank you.
Is it? Well, we'll take the vote on the minutes subject to adding that line in, if everyone's happy with that. Yeah. Thank you very much. Right. Could I have a show of hands in favour, please? Okay. Any against? No? Any abstentions? Just one. Thank you very much. Agenda item 4, announcements by the Chairman, Executive Councillors and Lead Officers. Lincolnshire Show, excuse me, Just a quick reminder for members that the Lincolnshire show is taking place on the 17th and 18th of June. Please ensure you have arranged your attendance and tickets. If you need assistance, the Democratic Services will be happy to help. The show is an excellent opportunity to see a wide range of work undertaken by the Council, including adult care services and many others. As members, we all have an important role in promoting and supporting work the Lincolnshire County Council does. So I encourage you to attend if you are able to. Turning to today's business, I would ask officers presenting reports to take the papers as read and provide a brief summary of key points. This will allow more time for questions, discussions and scrutiny on the issues before us. That concludes my announcements. I'm going to ask Councillor Steve Clegg, do you have any announcements, please?
Thank you, Chairman. No announcements, but I would just like to reiterate what I said at full council, is that I do listen and I do respect the comments of all members of this scrutiny committee. Thank you.
Thank you, Councillor Clegg. I've demoted you, Martin, sorry. Martin Samuels, Executive Director of Adult Care. Is Martin Parker here? No, he's not. So, Martin, have we got any announcement, please?
Yes, Chair. So I'd like to make announcements on two items. What I'll do, if it's okay with you, is I'll mention the first one, which is about the CQC. I'll pause if there are any questions from members of the committee, and then I'd like to make a second statement about short breaks. And again, subject to your agreement, then members may want to ask some questions.
Yeah, we'll do that, Martin.
Try to keep both of them brief, though.
Perfect. Thank you very much.
So if I start with the CQC, with the Care Quality Commission, we had expected to be able to bring the CQC report from the recent local authority assurance process of Lincolnshire County Council to this meeting, and you'll have spotted that the agenda of this meeting doesn't include that and is a little shorter as a result of that. If I can explain, so the draft report was received from the CQC on the 17th of April. The CQC make it very, very clear that those draft reports are to be treated with strict confidentiality. I am not permitted to share them with anyone other than the absolute minimum. And the reason that they require strict confidentiality is partly because these are CQC reports and they reserve the right for them to publish them as opposed to anyone else, but also because the draft reports are subject to amendment in all sorts of areas. The normal process is that local authorities are given 10 working days to provide factual accuracy comments on the report, which are then submitted back to the CQC for them to consider and to produce a revised report. And that's part of the reason why they're very, very clear that the draft report should not be shared. So I submitted those factual accuracy comments to the CQC on the 1st of May, which was the 10th working day after the draft report was received. There were quite a lot of factual accuracy comments. As a consequence, when the CQC acknowledged the receipt of the comments that we'd made, they said that it would take them longer than usual to respond to those. The normal process is that in the same way that the council has 10 working days to respond to the draft, the CQC normally has 10 working days to respond to the comments. And I say on the day the comments were received, CQC acknowledged receipt and said it would take them longer than 10 working days. I have been on a regular basis gently prodding the CQC to see if I can get some feedback as to when they are expecting to come back to us. Today is working day 21. I've received no comments back from the CQC, so it is still in progress. I think we're in a position where the accuracy and robustness of the report is more important than the speed with which it is delivered. Members of the committee will be aware that the site visit for the inspection took place in early December, so we're now 6 months since then. We already have a robust adult improvement programme which has been reporting to this committee. An extra few weeks I don't think is going to make much of a difference.
We are expecting once the report is received, the final report is received, that the CQC will publish it within 7 to 10 days of that date. I'd like to offer to the committee that we would do a private briefing for the committee on the day of publication. Unfortunately, I can't give you any indication of when that date will be, because I don't know when we'll receive the report. I therefore don't know when it'll be published. But as soon as we do know the date of publication, we will put something in the diary, and obviously all members of the committee will be very welcome to attend that. Subject to the report being received in good time, and I would hope that it would be, it is our intention to bring a public report to the next meeting of this committee on the 29th of July, where we would both bring the report, which will have been in the public domain, and provide an update on the LCC response. Thank you, Chair.
Thank you very much. Do we have any questions? Councillor Reeve.
Thank you. Do you have confidence in the validity of the report? I guess there's been a lot of inaccuracies so far, what you've picked up. The actual report in general, do you feel that they've seen what they should have seen and interpreted it in the way that it should have been interpreted, or would you not be in a position to comment either way on how you feel about the report so far?
I think in your last comment, you're spot on. I don't think that I can comment on the report. I think members of the committee can draw their own conclusions from the fact that the number of factual accuracy comments made were so great that it has taken the CQC now more than a month to consider those, and that they still haven't come back to us.
Councillor Overton.
Thank you very much. Can you suggest 3 quick things in the improvement plan that you think are really important and will really make a difference to people's lives?
Oh, that's taken us rather off the focus of the CQC.
Yeah, we need to be sticking to the CQC.
I know I can't ask the same question about the CQC, so I was asking about the plan, which obviously connects to the CQC. Thanks.
So I'm happy to give an update on the improvement plan. I mean, we've brought updates on that to the committee previously. I think the point I would make is that the plan has not been developed in response to the CQC draft report. That's something that we developed over. I mean, I think the first draft of the plan was developed about a year ago. It has a range of areas that will make a significant difference for Lincolnshire people. There's a lot in there about social work practice, about a person-centred, strength-based approach. There's a number of areas where we're working to improve social care processes, which will make a big difference for people. We've been working significantly, as the committee will be aware, about working age adult mental health. So there are a number of areas which will make a direct impact on people. That plan predates the inspection. We will review and revise the plan in the light of the final report when it comes from the CQC, and that will be part of what we'll report to the committee on the 29th of July.
Perfect.
Thank you,
Martin.
that's helpful.
Thank you very much. Thank you. Councillor Woolley, is this regarding CQC?
It certainly is.
Perfect.
Martin, to hear that a CQC report contains so many inaccuracies that it's taken longer to go back, it can be looked at in a number of ways. Either CQC came in and they were ill-equipped and they weren't doing their job very well, or indeed, which would be a little bit surprising because they'd already visited us in the it seems such a long time ago now, but in the first round of this new inspection regime. So they weren't unfamiliar with Lincolnshire and the way that Lincolnshire worked, albeit that they may have looked at different areas. So I have to say that I'm exceedingly worried to hear that so many, what you've sent back is... There's so much behind it that it's taking them a long time to look through in detail. Absolutely, it needs to be spot on and accurate. But if they felt that everything was okay in the first place, then surely we would have just had a quick exchange of correspondence and that would have been the end of it. So it's bothering me. Hopefully it might bother one or two other people as well, you know, that what we have in place is they're finding wanting. Is there any, and I know that I did ask, I don't think it was at the last meeting, but I think it was at the meeting before, that in the Principal Social Workers report, there was a section which was addressing the CQC findings, which were leadership and culture, data and evidence, consistency of practice, and developing an action plan. Well, I don't know how those decisions were arrived at to put into this report, but if that's the case, when are we going to start doing some work on this to get it in the right place? Thank you.
So I don't think it's safe to draw the conclusion that I think you're drawing. So if I explain a bit, so two things. First is the CQC have been very clear that for all of the pilot sites, so Lincolnshire was the first of the 5 back in summer of 2023. CQC has been very clear that for all of those 5 sites, they are completely putting that pilot inspection to one side. It is as if it never happened, as far as the CQC is concerned, on the basis it was a pilot, it wasn't their established process, and therefore, as far as the CQC are concerned, it might as well never have happened from a inspection perspective. I think it's fair to say that I'm happy to share with the committee that I have had conversations with the CQC about that, because I think that their position of, in effect, it was a pilot and therefore it never happened, they may take that view, but I think it is inevitable that people will look at the pilot report and the report that is published from this process and will want to make comparisons. CQC have been very clear to date that they don't see that as an issue. I don't think I'd agree with them on that one, as you can tell. In terms of the volume of comments, it is common for councils to provide many pages of factual accuracy comments on CQC reports. I think it is fair to say that the task that the CQC was given of undertaking inspection of authorities was a huge task. The CQC has not inspected, if I can call them commissioning organisations, for something like 15 years now. They don't inspect ICBs, they didn't inspect CCGs, they did used to inspect PCTs, but they disappeared in 2012. So this was a completely new area for them, and they were tasked by the previous government of taking on this completely new area and doing the whole country in 2 years. You'll be aware Ofsted inspect local authorities from a social care perspective on a 3-year cycle, and Ofsted are a very experienced organisation at doing this. So we had an organisation which was completely new to doing this, being asked to do it in 2 years. I think the troubles that the CQC has been going through are very public. So I think there are issues about the robustness of the process, but we will see what the final report says when it comes.
Thank you very much. Councillor Bean.
Thank you, Chair. Martin, just for clarity, we're talking about inaccuracies and discrepancies in the CQC's initial report. Surely does that not reflect more on the quality of their initial report than the quality of adult social care services in Lincolnshire?
I think there are concerns about the quality of the report, the draft report that was provided to us. So my concern is that they have either been inaccurate in their data, or some of the interpretations that they have drawn cannot be based on the data, and therefore we've made those comments. But it is currently with the CQC for them to look at the comments we've made and to come back to us on their view.
So just to come back on that, so it's basically a reflection of the quality of the report rather than the adult social care service.
The comments that we've made are about the quality of the report.
Thank you very much. Right then, no more questions. We're going to move on to the next announcement. Just before you get on to it, I'd ask members, please don't do a full-on debate on this. Ask questions by all means, because we will be coming back with this later in the year. And I will allow more time for it. And if I have to have a shorter agenda, then that's fine. So yeah, please, Martin.
Thank you. So Councillor Clegg has already made reference to his response at full council to Councillor Reeves' question. What I really wanted to do was to sort of build on that and share with the committee what we are intending to do now. So it's become very clear, not least through the very helpful contribution from this committee at its last meeting, that the process that we had gone through to develop options and consider proposals for the future of the short break service wasn't sufficient, and that the proposals that we had brought forward for consideration by Councillor Clegg were not as robust as they needed to be. I do want to emphasise that the sole driver in bringing forward those proposals was to improve the service. There's no intention to make a reduction in funding here. This isn't a savings programme. This is absolutely and 100% about improving the service. And I do also want to note that we, in the process that we had gone through, we had considerable feedback from a number of individuals who need short breaks but find that the current arrangements do not meet their needs. I think it's also pretty clear that the proposals that we had brought forward for consideration by Councillor Clegg have in many places been misunderstood and misinterpreted, and it has been presented as them recommending things which were not the intention. That was not what we were intending to do at all. In that context, I think it is entirely understandable that the concerns that people have had are understandable and reasonable, and therefore we need to take a step back. So Councillor Clegg has asked me to look again at the proposals. So what I wanted to do is to set out briefly what we are intending to do, and as the Chair has said, there will be an opportunity, and I'll set out in a minute, a full opportunity for the committee to look at this again. So we are now intending to run a full public consultation, a full 12-week public consultation, which will start on the 15th of this month and will run through to the 7th of September. That will have a number of elements to it. So one element will be there will be a questionnaire on the Let's Talk Lincolnshire page, that the Council's usual consultation page, and the Council will be actively promoting that consultation and that page for people across Lincolnshire. In addition, we will be contacting every single person who could access short breaks, and we will be inviting them to have a conversation with their social worker, and we'll be giving them the option that they can either have a one-to-one conversation with their social worker, so the individual and their family and their social worker, or they could have that in a group context of 4 or 5 individuals and families, whatever they feel would be most appropriate. And as I say, that would be with every single person who could access short breaks. So it's both the people who currently go to the service at Swallow Lodge and Cedar House, and those who don't go there, either who access other arrangements for short breaks, or who their social worker has identified that they would benefit from short breaks, but we've not been able to meet those needs through any of the routes that we have. So all of them will have the opportunity to have a one-to-one, all small group conversation with the social worker. We are keen to engage this committee. So the suggestion we'd like to offer to the committee a visit to Swallow Lodge and a visit to Cedar House, and also to some of the residential care homes that already provide short break services for individuals. And on that point, I do want to take the opportunity to underline and to correct some of the misunderstanding that's been made, that I think often when people think about residential care, they think about residential care for older people. There are over 100 residential care homes in the county which focus on working age adults. So these are not care homes for older people, these are care homes for working age adults. And a number of them already provide short break services for individuals. So the offer is that we would like to an opportunity for members of the committee both to visit Solar Lodge and Cedar House and some of those care homes that already provide this kind of service. And we are suggesting that those visits could be arranged on the 7th and the 9th of September. So again, just picking up Councillor Clegg's statement at full council, I think Councillor Clegg has made it very clear that he would like to be personally engaged in this process. So Councillor Clegg would be joining those site visits. He will be asking individuals whether they would be willing for Councillor Clegg to sit in on the one-to-one or group sessions that they have with him. I should note we are having to be quite cautious in the way that we engage members in this on the basis of advice from legal about the robustness of the consultation process, that we need to make sure that we don't run into a position where people have a conversation either with members of the committee or with Councillor Clegg that they then think is their contribution to the consultation, and therefore that undermines the robustness of the consultation process. But we will be making that opportunity. So in the meantime, the existing service will continue as now, and it will continue through until whatever decision is made about whatever the future would be. So the intention is to come back to this committee with proposals for the future in December, the meeting that's in the diary already in December, and that we would then bring recommendations for the future to the executive at its meeting in January of the coming year. And therefore we are going to bring forward a proposal to extend the current contract with the current provider for the current service to the end of July 2027. And that would give sufficient time for whatever decision was taken for that to be implemented. So two last things, Chair, if you'll forgive me. So the first is to be very clear, no decision has been taken. All options will be under consideration through the consultation process and will be explored and considered and reviewed for the consideration by the executive in January, and therefore by this committee in December, and that regardless of what the decision is about whether the service should or shouldn't continue, if the service does continue, there will need to be an open procurement process to secure a provider for that, because it's a contract. And so what we're deliberately saying is to extend the current contract to the end of July, so that whatever decision is required can be taken, and then whatever action is required after that can be taken for a smooth process through that. So very clearly leaving all of the options open, no decision taken. We will go through the process, and that will come to this committee before it goes anywhere else. Thank you, Chair.
Thank you very much, Martin. Like most people here, I suppose we've all had emails regarding this, and I have responded to them. It is an important thing, so I'm really pleased what you've just announced. Absolutely fantastic. Regarding consultation, will this committee have any input with the questions that are on that consultation? And also, the December meeting, could you make sure it's really short? Because I just want this as the main item, if possible. Thank you, Martin.
So in terms of the December agenda, obviously we will work with yourself as the chair to ensure that there is plenty of time on the December agenda for full consideration of this item. In terms of consideration of the questions. I'm going to have to come back to you on that one again. That issue about ensuring the robustness of the consultation process, so that there can be no suggestion or consideration that any questions are leading in any way. So I'll come back to you on that one if I may.
Okay. Thank you, Martin. Councillor Cook.
Thank you, Mr. Chairman. I will keep my comments brief. I firstly want to thank Councillor Clegg actually for his apology at the full council meeting. I know it's never an easy thing to do. I've been around politics for a long time now, probably far too long, in my own opinion. But it was the right thing to do, and I want to briefly place on record my concern about the recent position regarding short breaks provision, specifically Swallow Lodge and Cedar House. And I welcomed the assurance given by our executive member at full council that no final decision had been taken, that both Swallow Lodge and Cedar House will remain open while further work takes place. However, I do think we need to ask as a scrutiny committee how we got into this position. And my concern is that the process to date appears to have caused unnecessary anxiety for some of the most vulnerable residents and their families. And thank you, Martin, for confirming that it will be a full, meaningful, accessible consultation. And I thank you for the clarity that all affected service users, families, carers, staff, providers and relevant stakeholders will be contacted personally, which I presume follows on from the legal advice we've received on this matter as to the state of the consultation, which I think when we last spoke you said you were awaiting legal advice on that. I think we do need a clearer view of the process that led us to this point, because obviously we have been let down at some points on the way on this, including how families were contacted, how their views were recorded, how risks were assessed and how members were briefed before proposals reached this stage. And I think before any new proposal is brought forward to this committee, we need to be satisfied that the council has properly considered the impact on these individuals with complex needs, the availability and suitability of alternative provision, transition planning, continuity of care and the future use of Swallow Lodge and Cedar House. You know, I think I speak on behalf of us all, and I want us all to succeed as a county. And I think our priority now is we've got to rebuild that confidence and provide clarity to service users and families to ensure that any future decision is based on the results from a genuinely robust consultation and full understanding of the real world consequences for those who rely on our services. So I am pleased to hear that it is going to be a full consultation, and obviously I look forward to playing a full and active part in that. But I do believe as a committee we do need to look back as well to see how we've got ourselves into this position.
Thank you, Councillor Cook. Yeah, I couldn't agree more. I think in the December meeting, Martin, if you can add them details how we got to the position so we can discuss that at the December meeting as well. Thank you. Councillor Bean.
Thank you, Chair. So, Swallow Lodge and our other and Cedar Lodge, yeah, they're obviously extremely valued by the surface users. So my question is, if it is decided after this consultation that we retain these two facilities, surely in the interest of equality we should be looking at providing a similar sort of service in the northern half of Lincolnshire, because both of these are in the south of Lincolnshire.
So these will be issues that we're looking at through the process. I think so. One of the issues that we've got is that at present the bulk of the short breaks capacity that is offered through Swallow Lodge and Cedar House. As you say, those are in Lincoln and Spalding. So that's two locations for a very, very large, geographically large county. Part of the feedback we've had from people who could use the service is that either they do use the service but it's very inconvenient for them because of the location, or they don't use the service because it's very inconvenient for them in the location. There has also been feedback that the design of the buildings and the form of the model of care delivery aren't really aligned with what modern care would look like. These are facilities that were built 25 years ago. The model of care is pretty much what was delivered 25 years ago. Therefore, the purpose of this exercise is to ensure that people who need short breaks capacity are able to access capacity in a way that is convenient for them to access, is available for them to access when they need it, and is of a kind that they would wish to access. And feedback that we've had from talking with families is that a number of individuals and a number of families, the current arrangements do not meet that test. And as I've said at the start of this, the whole purpose of the exercise is to improve the service rather than to make any financial savings. And there is strong evidence that effective short breaks services make an enormous difference to people's quality of life. And therefore that's a good thing in itself. One of the consequences of people having a better quality of life is that they are less likely to have the sorts of crises in their lives that might then lead to them needing to go into residential care. And so there's both a better outcome now, but also a potentially better outcome in the future. And it is worth noting that someone going into residential care tends to be much more expensive than someone being able to live in the community in their own home, accessing short breaks. So the whole purpose of this exercise is that it's quite clear from a number of people that the current service is not particularly well aligned to the needs in the county, and therefore we're looking to make sure that we have a service which is better aligned to the needs of the people in the county. Clearly we didn't engage as effectively as we should have done in the process of getting there, and I recognise that, and the team are very conscious of that. But the purpose of this is to see, well, what should a better service look like in that open manner, and that will be what we will be doing further work on over the next several months, and we will bring the conclusions of that to this committee in December, and it will then go to the executive in January for a decision. But I do want to emphasise both that openness of we are looking at whatever approaches and models of care are most suited to people's needs, and that the aim is to improve what is available, improve compared to what is available now. And there is absolutely no suggestion of any kind whatsoever that there would be a reduction in short breaks or that people wouldn't be able to access it. I mean, that's one of the things that I'm quite concerned about, that there's been a significant misinterpretation of the proposals. There was never any suggestion that there would be a reduction in short breaks, let alone that the existing facilities would close down, and that would be that. And I can absolutely understand people being very concerned when they were told from some quarters that would be the case. And I would take this opportunity to be really clear. There was never any suggestion that the service at Swallow Lodge and Cedar House would close, and there would not be a suitable alternative for everyone that needed it.
Thank you, Martin. And it's fantastic you're doing the full consultation, because we'll see exactly what people really need throughout the whole of Lincolnshire. Councillor Lee.
Thanks, Chair. I listened to what Martin said just now with real interest, because you'll know that I had casework going back years around this issue. And I agree with all of the things that he says. And, whilst I don't agree with the way this has been done, I hear what you're saying, and I'm not opposed to change. I think the real problem is it's an issue around trust for me, because last year we had a full public consultation around the provision of adult healthcare, and hear me out because this is pertinent. We had that consultation, it came back overwhelmingly positively in support of that service. We had discussion at this committee about 3 times. It was pushed through this committee by the sheer power of voting numbers, and that consultation, we were then told it wasn't a wish list, and actually we're not having One New Lincolnshire anymore, we're not commissioning it anymore, we're getting rid of it, and we're putting the money into children's instead. So are you really surprised that the public don't trust this? Because, that's what it comes down to. And that's why I don't trust it either. You can have a consultation, but then it comes back and the portfolio holder and the executive say, sorry, not doing that. You know, and that has been my worry about this, not the actual change, but the process of doing it. So I would just make that point and actually take on board and learn from what they did last year to One Year Lincolnshire, because there's now no provision for preventative care for adults from LCC. It's gone to children's, apart from what the government pay for. So, you know, you can't blame people not trusting this, but I absolutely trust Martin. And I do think that actually some change may well be positive, but it's got to be done with people and not to them. Thank you.
Thank you very much, Councillor Lee. I think what Martin's proposing, it will be done with people, as everybody's going to be contacted, so thank you for that. Councillor Overton.
Thank you very much, Chairman, and thank you for your comments. And I did thank Steve earlier for his good response, I think, to the issues raised, and a good decision in holding this off. There are a couple of things that worry me a little, and perhaps you can allay my fears. One of them was that you suggested that everybody could talk to, all of the people who use the current service could talk to their social worker. They tell me they don't all have a social worker. So is that, have you got some additional provision planned to make sure that that's possible? Secondly, the robustness of the consultation could be undermined if people speak to members and as they go round, and I'm really worried about that, because the suggestion that because they've said it to a councillor, they're going to think that that's good enough and not then submit it formally in the proper process, I think is not reasonable. I think what we should say is that if we receive information or comments, that we should forward them to whoever, you know, if you give us the right, I've been forwarding them to Steve Clegg, actually, poor chap, but, you know, maybe there's a particular source that you can, a particular place that you want us to forward them to, so that we can be sure that they're all properly captured in the process. Thirdly, the point about this is not a reduction in service. The point I made at that last scrutiny, which I thought you had picked up, is that there were 14 beds available in these two houses, in these two places, and the proposal was to sign for 12 commissioned beds elsewhere. Now, if you're commissioning beds from other places where they are already available now, and you're just commissioning them rather than somebody else commissioning them, that is not an increase, that is a reduction in the beds that are available in the county. I'm not saying it's a reduction in the beds from the county council are paying for, but it's a reduction of beds that are actually in the county. And I don't think private companies will be holding beds if they're not needed. So I think it's really important that we actually be clear about this. And I know you were trying to tidy up any misunderstandings that are around. And I think the alternatives will be available. Tamar House was one of the ones that was brought forward. I did ring them. They said they do not take people of high care. So just to finish, sorry, I beg your pardon, I have gone on a bit too long. But the point I was just going to make is that I know Martin Samuels was trying to clarify and, make sure there are no misunderstandings. But it's not quite as straightforward as that. Thank you.
Thank you. Just before you jump in, Martin, could you keep this really brief? Because we've been on for about 45 minutes now, and this is only an announcement. It's not like a full-on debate. So... It's an announcement. Well, thank you, Martin. It's announcing that we're basically doing a full consultation. Martin.
I will be brief. So in terms of social workers, your first question, the general rule is people don't have an assigned social worker, but we have social workers who are very experienced in working with either individuals because they have ongoing issues, or they are very experienced with working with individuals of that, who have those sorts of needs. So we would be making sure that an experienced social worker who either knows the individual or has good experience of individuals with those sorts of needs is able to talk to them as they will offer on a one-to-one basis or on a small group basis, and it will be every single individual will have that opportunity. In terms of the robustness of the consultation, I say the concern has been expressed by the engagement team that run this process that individuals might have a conversation with a member outside the consultation process and then believe that that is their input to the consultation process. And what we're keen to do is to make sure that all of the views are captured by the consultation process. So therefore, if members of the public do talk to you as members, I would encourage you then to forward those to the engagement team so that they can be built in. The issue there will be that the consultation will be a number of questions on the website, and the conversations with the individuals will be structured around those questions so that we can get statistically significant responses to the questions, and those will form the basis of the consultation analysis. Of course, if someone sends, as a member of the public, sends you, as a member of the committee, an email or has a conversation with you, that's not going to be structured around those questions, and it makes it that bit harder for us to incorporate it into the consultation. And it's simply that issue. We want the consultation to be absolutely robust. And picking up Councillor Lee's comments, I am absolutely clear that the analysis of the consultation responses that will be presented to this committee, to the executive, will be a fair and robust analysis. Finally, and I will try to be very, very brief, so Councillor Overton's point about the number of beds, it is very common that not all of the 14 beds in Swallow Lodge and Cedar House are available. That will either be because essentially the position regularly is that individuals receive short break support there, and their needs are such that they need more space than just the one room. So we are quite often in a position where there are individuals who are receiving short breaks at either Swallow Lodge or Cedar House, and only they can occupy the premises at that time because their needs are such that others cannot be there, or they can't cope with others being there, others wouldn't be able to cope with them being there. So very frequently we don't have 14 beds available. It's a much reduced number. And then the last point I'll make is that we currently have something like a 20% vacancy rate in care home beds across the county. So there are significantly more beds available than are occupied, and therefore there wouldn't be any reduction in...
Thank you very much, Martin.
But I'll stop there.
Perfect. Councillor Woolley.
Thank you, Chairman. I'll just let the red arrows go over before I attempt to have a word. My question's going to be to Councillor Clegg, but in the first instance, I want to grumble at you, Chairman.
Perfect, Councillor Woolley. I always love a good grumble.
You mentioned a little while ago about, we're 45 minutes into, and it's only announcements. I'm happy to sit here all day if it means that we're doing things properly. And I think, as we well know, there's going to be a lot of people listening online this morning that want to know what's happening about this particular service, the short break service. So 45 minutes is not very long. And let's just remember that we wouldn't have been here in the first place 45 minutes later if we'd have actually had something done in the proper order. So this is where my question to Councillor Clegg is that ultimately, Councillor Clegg, it is for you to bring the paper forward, to sign the paper off, that the paper that was put in front of scrutiny had got all of the right information in, all of the full information in, and yet there was absolutely no mention of consultation whatsoever. So we've heard from Martin this morning exactly how important consultation is. Legal advice has said we should have a consultation process. So why wasn't this done in the first place? And then we wouldn't be here 45 minutes later, Chairman. Thank you.
Just before you jump in, Councillor Clegg, thank you, Councillor Woolley. I always do love a good grumble. It's now 55 minutes. Also, it is a substantial item which is coming in December, as I said. But
Chairman, if I may jump in, December is a long time
It
off
is, but
for
that's
those
why-
residents affected by this. We've got to be seen to be looking
Absolutely.
at this.
But that's why Martin explained everything fully and clearly, excuse me, so that everybody could understand what was really going on. So when it comes back to December, we are going to have a full-on debate. If that takes all night, I don't mind. Councillor Clegg.
Thank you, Chairman. Thank you, Councillor Woolley. A lot of what you've asked I have answered already in full council with respect, so I'm not going to repeat it here and now. Suffice it to say, consultation or engagement was conducted, but what is clear, and this is why we're back where we are, and hindsight's a wonderful thing. Yes, I wish we weren't, and when we were where we should have been at the previous Scrutiny Committee meeting. All I can say is I assure you that moving forward, as Martin Sammers has said, we will engage with all those people that either use the service or could use the service. Thank you.
Chairman, if I may, consultation and engagement
We're
are
going to
two
move on now,
entirely
Councillor
separate
Woolley.
things. And
Thank you very
Councillor
much,
Clegg
Councillor Woolley.
has only
We're moving
talked
on.
about engagement.
We're moving on now. Thank you ever so much, Councillor Woolley. This is coming back in December, and we are going to have a full-on debate about it. The consultation will go ahead, which is Martin's explained everything that's going on. Thank you very much. Now we move on to the next item, agenda item 5, housing-related support HRS service. This pre-decision scrutiny report can be found on pages 9 to 20 of the agenda pack. The committee is invited to consider the report and to acknowledge the report's recommendations to the executive ahead of the decision on 9th of June 2026. The views of the committee will be reported to the executive following today's meeting as part of its consideration of this item. The report will be centred by Martin Samuels, Executive Director for Adult Health, and will be further presented by Anne-Marie Scott, Assistant Director Public Health. Also in attendance is Amy Smitherson, Public Health Programme Manager. Martin, thank you.
I'm afraid yes, more of me, but I will try to be very brief. And our intention is that Anne-Marie will be available to answer questions, but it'll just be me presenting for this. Members will be aware the Housing Related Support Service supports up to 323 people at any one time to help them maintain stable tenancies. It's focused on individuals who are going through LCC-funded substance misuse programs or people who are receiving support in relation to their mental health. There is a close correlation, members will be aware, between stable housing and individuals' ability to complete those programs successfully. I should be clear that the housing costs, so people's rent, those costs are met by the districts, not by the county council, so the county council funds the support that people receive, doesn't fund the accommodation itself. The service is very successful in enabling people to maintain their tenancies. That is a benefit to the county council because those individuals then complete the substance misuse programs and are more able to engage with the mental health programs. But it is true that the bulk of the benefit falls to the districts because it avoids those individuals becoming homeless, and homelessness is a district responsibility. Members of the committee will be aware that we had previously extended the contract with Framework until the end of March 2027 to allow a formal public consultation on options for the longer term future of the service. That consultation has now been completed. We have done significant work in developing proposals and we were in a position that we were expecting to present those proposals and a recommendation to the executive next week, and therefore we were expecting those proposals to be considered by this committee today. I'm now going to explain why that's not happened and why we're in a different position. So as part of that process, we had been undertaking significant engagement with the districts about whether they would be willing to contribute funding towards the service on the basis that it was the districts that gained most of the benefit from that process. On the 30th of April, a letter was sent by all 7 district council leaders to the leader of this council stating that they were now, and I'm quoting here, receptive to exploring joint funding options. The leader, the County Council leader, responded on 21st of May, welcoming that letter from the district leaders, and I think it is a very positive development. And in the leaders, County Council leader's letter, he set out some high-level proposals for engaging with the districts. Therefore, in order to allow there to be time for discussions with the districts to take place, we are now suggesting extending the current contract by a further 4 months to the 31st of July 2027. That's a fairly short period of time, deliberately so, partly because we can't allow this situation to drift. There can't be the uncertainty for the provider and for their staff and for the individuals who draw on that service. But equally, we need to recognise that the districts will need some time to consider whether they are able to make a financial contribution to the service, and if they are, for it to go through their decision-making process. So we believe that a 4-month extension gives enough time, but not too much time, for those conversations to be brought to a conclusion so that a future option can be taken forward. The aim would be, and I've managed to forget now what the timing, Anne-Marie will be able to remind me, the intended timing for bringing this back to scrutiny and then taking it to the executive. But we're in a position where if we weren't proposing this further contract extension, then we would have to rule out the possibility of district funding and simply bring a report forward to the executive for a way forward based purely on LCC funding, and therefore it seems reasonable to seek a further 4 months to allow that conversation with the districts to take place. So having said that, I wasn't going to ask Anne-Marie to say anything. I am going to ask Anne-Marie to remind me and the committee on the intended timescales for coming back to this committee and then to the executive.
Thank you, Anne-Marie. Take as long as you want.
So just on the timescales only, so we are currently planning that that would mean it would return to scrutiny in September, and decision being made at October executive.
Thank you very much. I'd now like to invite members to ask any questions on the item. Councillor Clun, do we have any questions? Oh, Councillor Woolley's. Councillor Woolley.
Happy to let somebody else go first, as long as I get a turn at some point.
Okie dokie, if you want. Councillor Bean.
Thank you, Chair. I'm just wondering, are there any actual commitments from the district councils beyond expressing that they're receptive?
No.
Sorry, I missed that, Councillor Bean. Could you just say it again? Was there anything you wanted to say, anything extra, or is that it? Councillor Woolley.
Thank you. I think, first of all, the question is to Martin. Martin, the outcome of the public consultation regarding the housing-related support service is not included in here?
That will be brought as part of the forward look report, which will come to this committee in September and to the executive in October.
Right, so if I may just check with you then. Back in, I think it was January, views on the commissioned housing-related support service are currently being sought by public consultation. So can you just expand a bit on what that consultation was about, if it's not about this service for a start, please?
So the consultation was about future options for this service. So that consultation, that was a full public consultation. That process has been completed. The analysis of that consultation has been done. It will be used to inform the development of options and therefore brought to this committee in September and the executive in October. But that process is complete, and it will be, our advice that we've been given is it is not affected by the conversations that we are now having with the districts, because we were looking at a range of different possibilities. So it still remains valid and will be valid for the report that will come forward in the autumn.
Yeah, just to labour the point, it would have come today in this paper if today had been a decision-making day.
Yes.
Thank you. Can you then just explain to me, I'm missing something somewhere, the housing-related support element that we're talking about has always been provided by the Public Health Service, but certainly LCC. And suddenly, LCC appear to be asking the districts, whilst they provide the housing, the support to maintain people in that housing, it seems that we're asking the districts to now provide that as well, which is anywhere between, depending on what you read, £1.8 million as per the budget papers, or £2 million as per these papers. Is that what you're saying, that the districts are being asked to put that money in? Can you explain the thinking behind that as well, please?
So you're right that this service has been funded through the Public Health Grant and is currently funded through the Public Health Grant. I should note that the costs of the accommodation aren't funded by the districts at present. That is it's a housing function, and therefore they're funded through housing benefit and like so. In that sense, they're funded through DWP rather, so they're not a cost to the districts. The reason why we're looking at this again is that all budgets across the whole of the council are being looked at, and in this instance it is clear that the majority of the benefit from the housing related support service falls to the districts. So at present we're in a position where LCC through the Public Health Grant is funding a service where the majority of the benefit, the large majority of the benefit, falls to the districts, and therefore it seems appropriate to have a conversation with the districts about whether they would be willing to provide funding to support that service. But I think, you know, just sort of expand a bit on my response to Councillor Bean. The districts have indicated they are prepared to have a conversation, but there's no commitment beyond that, and that's what we want to see over the next couple of months, whether that can become a reality or not.
So following on from that then, if they all turn around and say, nope, we're not going to, presumably we will continue to provide that service because we've got a lot of vulnerable people here, and if we don't, we're going to end up with those that have got substance misuse problems being, well, on the streets and in shop doorways and whatever else. At least at the moment there is a structured situation where they are being supported to try and get out of that system. It just worries me a little bit about, from residents' point of view, exactly what could happen.
So we will bring recommendations forward to the executive in October, and that will be affected by whether the districts can offer funding or not. We've looked at all the options. Depending on the outcome of those conversations with the districts, a recommendation will be made. I think you'll understand it wouldn't be appropriate for me at this stage to prejudge what those recommendations might be. They will come forward in October, and this committee will have the full opportunity to discuss those in September. But we're deliberately seeking agreement to extend the current contracts so that there is sufficient time for all options to be considered, and whatever the chosen option might be, to take that forward in a smooth manner.
Thank you, Councillor Woolley. Councillor Overton.
Thank you very much. On your report, you said that further adjustments might be needed to the service. What adjustments were you thinking of?
Can I ask Anne-Marie to pick that one up?
Yeah, certainly. Yes, we've had to make some adjustments to the contract previously to ensure that we can remain within the budget envelope. Those have related to the floating support element of the service, and with that we've managed to maintain the number of people that are supported, but deliver the model in a slightly different way that was more cost effective for the provider. If that becomes necessary again, we will have to review that situation, but we will, wherever possible, seek to maintain the same amount of support that we currently have in, but that would be subject to conversations with the provider.
Thank you. Just in plain English, if you wouldn't mind, for the people who are receiving the care, are they receiving less in that case because you're trying to keep within the budget and you're still supporting the same number of people? So does that mean you're providing less for an individual?
So they're not receiving less support, it's the way it is delivered. So floating support can be delivered in somebody's home if they're at risk of homelessness or in a setting of their choosing. What we've done as a result is that some of that is delivered within the premises of the provider now. So it means they can see that more volume of people rather than having their travel around the county. So people are still supported in the same way.
So the individuals travel rather than the workers. I think that's the point, isn't it?
If that is necessary, yes. There's also opportunity for telephone-based support as well. So consideration is given for that individual still and what best meets their need. But clearly, if they are residing, say for example in Lincoln, it may well be that it is easier for them to travel than someone that is more remote.
Thank you. I think if we're looking to ask the district councils to support, I think we need to have something that is worth supporting. And if you were able to say that these people are of particularly high needs and need, obviously if you've got drug problems and all these things, a face-to-face is very hard to replace, I would have thought, in that circumstance. And that might be, if the districts did fund the accommodation, and that enabled the best type of support to be given to the people who need it, then that might be a very good reason for adding that extra funding in for a district council. Thanks.
Thank you. Councillor Reeve.
Thank you. Two-part question, and the second part may not be relevant to this committee, but I'm going to ask it anyway. Initially, what specific evidence demonstrates that a 4-month extension period rather than longer or shorter period is the appropriate time span to explore this joint funding option? And the second part would be that the success figures that was quoted in the report actually appear quite good. I'm quite surprised to hear how successful this scheme is. However, there are always people that fall through the net for various reasons. And I do have concerns that it was initially called care in the community when facilities such as St John's in Lincoln, I don't know if you're familiar with St John's, a mental health facility where people were detained. And that closed and we went over to care in the community, and I'm increasingly seeing situations where people have been placed in the community, they refuse to take their medication and they become dangerous and intimidating. But I don't know, I guess that's a national legislation thing that we have to work with, not something we can work with locally. I wouldn't want to see people become institutionalised, but at the same time, the people that fall through the net do present a danger in society, or at least a perceived danger that causes a lot of stress to people dealing with those situations. But if you could, the main part is the first part of the question around the time span. Thank you.
And again, I think, Chair, if I can ask Anne-Marie to pick that up.
Yeah, so the timeline has been built around governance processes. So the process we obviously need to go to reach the decision, and then post that decision, the time that would be needed to implement what those options could be. So those are quite established in terms of commissioning timelines and what we would expect that to be. We also need to take into account that there will be people already in the service and if we're going to make adjustments to the service or a change in the future, we need to make sure that those people can be ultimately supported through that. So we've used sort of unknown experience on commissioning, but also how long people would expect it to be in the service and what that transition would look like for them.
Thank you. Councillor Bean.
Thank you, Chair, but my question's already been covered.
Thank you, Councillor Bean. Councillor Lee.
Thanks, Chair. There's a question, just because I want to make sure I've got this right, and then just some comments. Just to be clear, this year we had a record level of government settlement, best we've ever had at LCC that anyone can remember. And we also get the public health grant from government to provide stuff like public health. We don't do it out of the goodness of our hearts, we're actually given the money to do it. And this service, as far as I can see, this service is providing the mental health care. LCC pay for the mental health care side of it, and the districts are paying for the accommodation. Have I got that right?
So the care services are funded differently, so they come from a different part of the council. So I'll try to be brief. If you have care needs due to your mental health, then either that'll be through the social care budget, or it may be that the NHS is paying for that. Yeah. If you're going through a substance misuse programme, that will be funded through the public health grant. But what this service funds is the support to individuals to maintain their tenancy. So it's not the direct provision of care, it's an additional support function.
But by nature, supporting their mental health does enable that, so the two. So what is it that we're actually, as I said, we get a really good, generous amount of money from government to pay for this sort of thing, and the districts have got much smaller budgets. What are we actually asking the districts to pay for if they're already paying for housing? What extra are we asking them? I understand the rationale that you've said, you know, because it means they're less likely to stay healthy, but what are we practically asking them to pay for?
So again, I make the point that the districts have the homelessness duty, but they don't fund the accommodation directly. If someone becomes homeless, then there are costs which will be met by a district, but the normal accommodation costs are paid through the housing benefit. So the issue is, as I've said, that every budget in the council, every budget line in the council is being looked at quite carefully as to, is this something that LCC should be spending its money on? In terms of the public health grant, if we weren't spending the public health grant on this, there would be other things that we could spend it on. And I think it's worth noting that most councils don't spend public health grant on this kind of service.
But what will this extra that we're asking the districts to pay for cover? How will that money, if they were to pay it, how would it be spent? Again, I'm going to turn to Anne-Marie behind me as the expert on the detail.
Okay, so as the current service stands, the provider tells us that there are financial pressures in that. So we know to deliver the current service we have now would cost us a lot more than it currently does. So as part of the sort of discussion with the districts, there's something around, would their contribution enable us to maintain something like the current service? Because we know that the 2.2 million we currently spend, it would cost us more than that if we went out tomorrow. So can I just interrupt you there? So if they were paying, they'd be paying towards the mental health, the practical costs that we currently pay for, they'd be chipping into that. That's the bottom line of it. So this contract provides support for individuals, so casework support. These aren't health professionals that are supporting the individuals. They're diverted into other services to receive that. So depending on discussions and conversations with the district councils, we would of course look at the specification for the service, whether any amendments that we would want to make to that they would like to see as part of their contribution to the service. But as Martin has said, whilst it is not a homelessness service, it does provide accommodation for people who are homeless that the districts may otherwise have to provide for that individual. And of course, from a prevention perspective, people that have been through HRS are more likely to then be able to sustain a tenancy in the future, which means they won't be in that cycle of homelessness and back at district council customer service centres for support.
Yeah, I do understand quite a lot about this. When I was the MP for Lincoln, I did a lot of work on this. I think just for me, the concern is, as I've said, that LCC get a much bigger budget than the districts, and the districts are already paying for accommodation, and you're asking them to find money that they might not have just to keep what we've got going. And my concern around this is, as Councillor Woolley has said, this is about people who may end up sleeping in doorways, because I can't imagine that the districts will have the money for this. And I'm sorry, but I'm going to say this at a scrutiny committee. This is yet another, as in 1U Lincolnshire, when we abolished adult public health services and put it all towards kids. This is just yet another ideological attack. Should we really be paying for this? Should someone else, and this isn't aimed at the officers, should the districts not be chipping in? Because this idea that LCC have got no money, we've just had a record government settlement and we've got nearly £50 million in reserves. LCC put away money for a rainy day under the Conservatives. I didn't agree with much, but they did that, and they did that well. So this idea that we've got to cut corners, and if someone else isn't going to pay for it, then actually we'll just scrap it, because I can see that's what's probably going to happen in the end. It's just yet another ideological attack by a reformed control administration.
Thank you, Councillor Lee. No more questions? Lovely. Oh, Councillor Overton.
Thank you. I think I understood that you said that these rents are paid by the benefits, not by the councils. So the districts would have to take the money out of their homeless prevention budget, I think, which is presumably currently being spent on homeless prevention elsewhere. So it probably would mean that that budget would have to expand. But my question is about the high level of needs of these residents. You said it was effective, and I'm not sure I've got the evidence to show it ought to be effective. It must be. But I think helping somebody stay in their accommodation ought to be effective. But I can see the conflict of interest to some extent, because obviously the districts want their rent paid, and then at the same time they don't want to make the person homeless, and they are, do you find that there are people of high needs and difficulties that have to remain in their accommodation, that are remaining in the accommodation, even when they might in other circumstances be made homeless? Are they being especially gentle on these folk because of their in the system?
I'm not sure quite what the question was, Councillor Overton, at the end there. Would you mind just repeating that?
It is complicated because I have a resident in my head that I'm thinking of, and I'm trying not to say that, that might identify them. So I think, there are cases where there are people with very high needs and they need a lot of support. But perhaps if it's a council house, they might be inclined to, to let them stay anyway, despite the fact that they haven't actually improved their behaviour. Or do you find that councils are quite strict on that as well and really want the person to improve and not just let it ride? Thank you.
So the councils refer people into housing-related support. They can stay in service for up to 6 months until they're ready to leave. And the provider will then work with the councils to find suitable accommodation for the person at the end of that, and that will be very much based on what that need is. There is some provision as well within the service for people to have a period of floating support when they've left the service. So if they've moved into their own accommodation, to help them settle into that accommodation. But the intention is that we work closely with the districts to make sure that where the person moves on to is suitable for them and does meet their need.
Thank you. It just shows the importance of floating support, and that's the one that you would have to cut if you didn't have enough money. I think that's what you were saying, that people would have to come to the office rather than this is people with chaotic drug addicts having to get themselves organised to come to an appointment, rather than the worker going to them. So I can see it be quite difficult. Thank you.
Thank you very much. Councillor Reeve.
Thank you. It's not so much a question, just a statement I'd like to quickly make. The 50 million that's been presented to the Lincolnshire County Council from central government is a drop in the ocean in terms of our overall budget. It's still taxpayers' money is the point I'm getting to. The district councils, I understand from what Martin said, have wrote to the Lincolnshire County Council offering to enter negotiations. They weren't badgered into it. They were perhaps invited to, but they weren't badgered into it, and they could still turn around and say no, according to what Martin says. And I'd just like to reiterate, this money is still taxpayers' money, whether it comes from central government, district councils or Lincolnshire County Councils. There's no magic money tree. We have a duty of care to spend the money in the appropriate manner. Thank you.
Thank you very much, Councillor Reeve. Thank you for your...
Chair, just a point of order. The 50 million was the reserves, not what we spend on this.
Right, thank you very much, Councillor Lee. That now concludes this item. Thank you for your questions and comments. A summary of your comments will be captured by the scrutiny officer and will be shared with the executive for consideration. I move that the committee has considered the report and the executive and that we acknowledge the recommendations to the executive. Do I have a seconder? Quickly before you
Just really quickly, are we just voting on the 4-month extension, not on approving of this? Can you explain what we're voting on?
Yeah, that's right. Yeah, this
just
is
the extension.
Yeah, this is what. Yeah, that's what we're voting on. Do I have a seconder, please? Councillor Reeve, thank you very much. Could I have a show of hands in favour, please? Anybody against? Any abstentions? Just 2. Thank you very much. That is agreed. I think we'll have a short break of 10 minutes now, so please come back in about 10 minutes, about 35 minutes past. Thank you very much. Right then, thank you for that short break. Agenda item 6, lessons from winter. This scrutiny report can be found on page 21 to 44 of the agenda pack. This report is an update of the progress and delivery of the Adult Social Care Winter Plan 25-26. This report will be introduced by Martin Samuels, Executive Director of Adult Care, and will further be presented by Andrea Kingdom, Head of Hospitals and Special Projects. Martin, over to you.
Thank you, Chair. The committee has heard all too much from me this morning, so I'm going to keep this very, very brief, and Andrew will do the main presentation. So members of the committee will be well aware that winter is a really, really important period for the health and care system. The combination of the cold and the weather leads to a lot of increased demand. Members will be aware, there's a lot of communicable disease, of respiratory disease during the winter, and then people are less physically active because of cold weather, and there was always the risk of slips and trips, which can bring people to have physical injury. So there's a lot of demand during the winter. We are currently in that lull where we've finished winter 25-26 and learnt the lessons from that, and we are yet to start the planning for winter 26-7, but that will be starting very soon. And therefore, it's a really good opportunity for us to bring forward to the committee some information about the performance during the winter that's just finished. I think it's a really positive story. There's a lot of very strong services delivered and some real achievement for Lincolnshire people. We'll highlight a number of the services and the lessons that we've secured from there. But again, I think there's a lot of positives there. And then Andrew will talk a bit about the planning process for the winter that is about, in planning terms, the winter that is about to start. And again, we're really seeking there to maintain the good outcomes that we've had for Lincolnshire people. So I'm going to stop there and ask Andrea to just bring out some highlights from the report, and then we can respond to questions and go into whatever depth members may wish.
Thank you, Martin. Chair, members, I'm not going to go through every service provision as noted in the report, because each service had contributed to the success of the hospital social work team's winter plan. But I will briefly summarise the performance of the plan, its impact, and the key learning for winter for 26-27. So planning for winter 25-26 began in June 2025, using learning from the previous winters. Hospital social work managers also supported system-wide preparation, with hospital team managers participating in a number of exercises led by NHS England to analyse and validate the winter plan for Lincolnshire. Despite an early rise in influenza pressures, the hospital social work team's winter plan remained stable and resilient throughout. The team supported 5,534 safe and timely discharges across multiple hospital trusts, and importantly, no surge or super surge measures were required. That means that at no point did the hospital social work team need to call on others or our area colleagues to offer additional support. And this reflects our strong preparation and effective operational delivery. The winter plan successfully focused on reducing delays by staff being ward aligned and commencing early interventions through strength-based conversations, avoiding unnecessary admissions, with 632 people being assessed by our teams in the emergency departments at Lincoln and Boston hospitals, of whom only 48 were eventually admitted. We also supported independence, and that's evidenced by the 1,426 people requiring no further ongoing services following a period of time with our home-based reablement service. And our recent analysis shows that 87.4% of people discharged home from hospital with reablement were still at home 91 days later, receiving no services, compared to 68.1% of people that were discharged home without reablement. Previous cost comparison analysis indicates that weekly average home care costs without reablement are £240.54, compared to £25.32 following reablement. These figures show the effectiveness of this service, particularly when winter periods can increase risks, especially to older adults. Active recovery beds also supported people to regain independence with robust goals and outcomes set between the person and our occupational therapist, focused on building independence and resilience. Analysis has shown that for every £1 invested by the council in active recovery beds, £4.70 is avoided in home care costs, delivering both positive outcomes and value for money. As the report advises, wider support from other services, such as the St Barnabas Community Care Nurse Specialists, led to 120 people prepare for end of life. And of those people, 66 were transferred from funding requests from adult social care to health funding, saving £849 per person per week. Just these 3 services alone ensured that people left hospitals safely and, where possible, recovered well and remain independent at home, which translates into better outcomes for the people of Lincolnshire. However, there were areas that did not work as well as planned and will feature heavily in our winter planning for 26-27. Whilst operational relationships with our NHS partners remained strong, changes within the Integrated Care Board meant we saw less consistent system-wide forums and fewer opportunities for structured escalation, shared risk and coordinated action. Issues were resolved locally, but this did not provide the same level of system assurance and is an area that we are currently addressing with our health colleagues. In preparation for winter 25-26, NHS England had highlighted the requirement for NHS trusts to make arrangements to ensure areas such as transport and medication did not lead to delayed discharges. However, this was not always successful, and these issues impacted upon people waiting to go home, and in particular on the reablement service, where the initial home visits had to be cancelled. Whilst the reablement service has significantly led to better outcomes for people and led to people living independently in a place they call home, random audits of referrals to the reablement service, both from hospital and community teams, over the winter months identified the need for stronger oversight and governance of referrals into the service, and more systematic recording of impact and outcomes by practitioners. And finally, a frailty unit was opened in Pilgrim Hospital at Boston, and in previous years the hospital teams have stretched their capacity to support these units. However, we recognise that this would add significant capacity pressure to our teams. So following a conversation with the unit manager, the unit offered to fund an additional member of staff. And this has reinforced the message that we learned during winter, that additional demand on hospital teams should be met by NHS funding and not by additional pressure on the social workers. Hence, the 4 key areas identified for 2026-27 from the winter of 25-26 have been advised as the re-establishing of a robust weekly system forum for escalation, oversight and coordinated action, improving system communication, particularly around delays in transport and medication, strengthening oversight of reablement referrals, ensuring the right people access the service, and aligning demand with NHS funding resource to protect core social work capacity. So to conclude, the winter plan was effective and resilient. It supported both residents and system flow during a pressured period, and it did so without escalation to surge arrangements. Our next steps are to begin planning for winter 26-27 with all partners, to support our NHS colleagues to strengthen system governance, and for our teams to maintain focus on outcomes, independence and value for money. Thank you, Chair.
Thank you, Andrea. Thank you, Martin. I'll now invite members to ask questions on this item. Councillor Cullen.
Thank you very much, Mr. Chair. Thank you, Martin. Thank you, Andrea, for such a detailed report. I welcome it, and I thank your teams for delivering it. Thank you. It's very positive to see we take preparations for the winter season seriously and give it the demands, the planning it demands. My question regards the targets that we set in June last year in preparation for 25-26, and if there were any, if we faced any financial pressures due to the targets that we've set, please. Thank you. Thank you very much.
I think our biggest financial pressure will always be the reablement service. Despite the savings that it makes in the longer term, there will always be that, because we never know exactly how many hours are going to be required. But what we do know is that even though we put that pressure onto the budget, the actual savings will override what the actual overspend will be. So reablement is something that we're focusing on very closely. Monthly meetings with the finance team to see how we're managing the budget around reablement service, because that makes such a big difference to people's lives.
Sorry.
Can I just come in briefly to build on the comment that Andrew has made? It's a really important point that she's made. One of the things that we're changing is that we've been in a situation where previously the council has set the budget, and it's set the budget in terms of individual budget lines. So we'll spend this much on residential care, we'll spend that much on reablement, and so on and so on and so on. And that's meant it's been quite difficult, where we've been in a position where, as Andrew has said, if we spend a bit more on reablement or a preventative service, that may well save much more money in another service. But because of the way the budget has been constructed, we're then in a position where the financial report said, oh, you've got an overspend in reablement or whatever that service is. And so there's a pressure to keep within the budget that's been set. What I'm working with my team and with our finance colleagues is to have a greater understanding of the interconnection between budgets, so that if there is more demand for reablement, and we've got the evidence that says if we put more money into reablement and support people more there, and therefore blow the budget, we will actually make a net saving to the council, because we'll have less expenditure in other areas. So it's a really important step in terms of our sophistication of managing the budget. And Andrew is really right to be pointing out those connections, and it's an area we're working on very actively.
That's really great to hear. Thank you very, very much for both of you. Thank you.
Thank you very much. Andrea, could you just turn your microphone off, please?
Sorry.
Thank you. Councillor Reeve.
Thank you. Whilst any system or plan can always be improved, I'm very pleased to see that there's no complacency within your teams, and in fact there's a constant desire to improve whatever can be improved. I'd just like to say thank you for you and your team for your efforts.
Thank you very much. Councillor Litchfield.
Once again, my question's been asked, but I'll change it slightly. So you described at the end of the report, you used the words effective and resilient, but then previously you said not everything went to plan. Were there any issues from 24-25 that were still prevalent in 25-26?
No, I'm glad to say. We did prepare extremely hard, and we supported a number of exercises within the NHS England, such as you'll see in the report, Exercise Aegis, where we went through every element and we looked at worst case scenarios, and then we implemented a plan where we called Surge and Super Surge. If we plan for this, if this doesn't work, what will we do to address it? If that becomes even worse, what will be our next step? We didn't have to, we were resilient because we didn't have to step into our Super Surge phases. I think what we probably hadn't planned for was NHS England's change to the ICB. The ICB have always led all the system collectively through winter, and that would be weekly meetings for escalations, shared risks. We lost those because those meetings got cancelled as the DLN cluster, so Derby, Derbyshire, Lincolnshire, Nottingham and Nottingham City, formed one ICB collectively, which they call the DLN cluster. Therefore, a lot of our Lincolnshire colleagues were having to move to new roles, apply for new jobs, and so I suppose we could understand that their future may have been their priority at that time, rightly so. So a lot of our system calls, which we used to have 2 or 3 times a week if needed, were stopped. And that did impact on things like the transport and the medication, because that oversight from the ICB was missing. However, we had such a robust plan in place that we were able to manage our own service area successfully through the winter.
Thank you very much. Councillor Cook.
Thank you, Chairman. Firstly, I love the title of this agenda item, Lessons from Winter. It's just it's quite a nice warm, well, it's not a warm feeling, is it? But obviously, but anyway, we'll move on from that. So obviously the winter report is rightly positive about outcomes, particularly around discharge and reablement, and I think well done to you and all your teams. But obviously HBRS delivered, I think it was 23,324 hours above forecast during that period. And I suppose really it's some thoughts around, you know, what is our view as a council in terms of whether that reflects exceptional winter demand, or is that sort of a structural increase in need? And I guess how is that going to be incorporated and reflected in the re-procurement of the home-based reablement and future budget planning? Because obviously, you know, is that just a bad winter, or is that what we're expecting, I suppose, moving forwards?
I think the winter started far earlier than what we expected. The influenza outbreak started about 6 weeks before anyone had actually thought. So we worked very, very closely with public health, and we always look at what's happened in Australia, New Zealand way, so what we're planning for what might come our way. But we hadn't realised that the influenza pressures would start as quickly as what they did. So for us, that meant that we had to start using our services perhaps more quicker than what we thought. Reablement, as Martin's just said, is that what we're looking at is those additional hours in reablement leading to the underspend in home care. So we need to marry the two sections up together to see where that really stands. Reablement is currently just going through re-procurement. So council kindly agreed that we would carry on with that service. And I don't know the outcome of that re-procurement because I wasn't part of the service, quite rightly so, but it will be announced shortly. What we will be doing is, as soon as we know who the provider is, whether it's the one we currently have or have a new one, then we will work with them to start looking at what is reablement. I participated in a national project over the winter months, solely focusing on what reablement could bring for the people of Lincolnshire, and it's made us look at who's coming through to the service, what are our objectives setting right from day one, what outcome will that lead to, and what will their impact be. So I hope that when we've already started some of the work, but when we really move that work forward, we will really start to see a drop in those hours.
Chairman, just as a follow-on, so are we going to sort of, as part of that re-procurement, are we going to sort of increase the hours we're expecting just simply because of the exceptional demand from last year? Are we going to bank in a certain, forgive me, I don't understand the whole technical detail, but will we bank in a certain majority number of hours? Let's say, okay, so last year it was 23,000. Are we going to say perhaps 15,000? I don't know how it quite works on that one. Hayley's probably best placed on that one.
Thank you. So really good observation. I think drawing from that and what Andrea's talked about, I think we need to do a period of analysis following this lessons learned to look at the referral rates. Were they all appropriate referrals? Did people get the appropriate outcomes? If they have, what we would then look to do is understand, well, actually, do we need to realign some of our resource, as Andrea's described, from home care much earlier down the stream to think about prevention? Or actually, does this mean that our communities and people's needs are advancing and therefore we need to look at realigning some more budget to that area? We're still in the process of that analysis at the moment, which will then inform the outcomes of the re-procurement and those further stages of what we do to prepare for winter.
Thank you very much. Councillor Woolley.
Thank you, Chairman. Andrea and team, well done. I'm desperately trying to think, playing for time, trying to find a question, but what I really want to say is, my goodness, if ever there was a proof of concept that working as a system actually provides the right outcomes, then this, not just this piece of work, but that joint working time and time again with the ICB and our health colleagues and our wider colleagues as well. My goodness, you know, the proof is there, the money that is saved, and also, but the quality of the outcomes for residents as well, you know, that they're still at home, they've been in hospital, they come out and they remain at home. That little bit of extra effort in prevention, it just teeth in, saves shed loads of money, doesn't it? And yeah, you know, it's really, really disappointing that the ICB were thrown such a curveball, because that 50% suddenly chopping workforce, it's a huge number. And I hope we don't go back to the days of arguing, it's your spend, no, it's your spend, no, it's your spend, etc. Because it didn't work. It won't work. If we've got something that is working for Lincolnshire, let's stick with it. And I know you will be trying to, and I hope we can all be supportive of that. So thank you.
Thank you very much, Councillor Woolley. Councillor Lee.
Thanks, Chair. Just to echo everything that Councillor Woolley said, you're doing a fantastic job. This is a brilliant report, the detail in it and the way it's worded. It's easy to read, but it tells you everything that you need to know. So well done on that. And like Councillor Woolley, I listened to what Martin said about, you know, £1 invested somewhere brings an investment somewhere else. And this is why I get so frustrated when it's, oh, we're not paying for that bit, you can pay for it. You know what I mean? And it's just, I can't bear silo thinking. It just makes no sense. And working in a broader sense, as is happening here, because as a nurse I can tell you there's such an inextricable link between health and social care. People complain about A&E, but you know what? Some of those people have been sent home too early in circumstances where they can't cope. And if you prevent that happening, if you're able to prevent that happening, then you tackle the root cause of something else. And that's what it's all about. It's not about bickering about who's going to pay for what. It's about working together to provide good services and good outcomes for residents. And that's what we should all be focused on. Thank you.
Thank you very much, Councillor Lee. Councillor Overton.
Thank you. Yeah, it's a, you know, having seen those services at first hand, they're really important, and knowing the impact that they can be. Is there unmet need, or are we catching all of the people that we could be helping?
I think we do miss some people, I'll be honest. I do think some people come in and the turnaround is so fast. So we've specifically aligned social workers with wards, so they're on the whiteboard first thing in the morning, so they'll know when somebody has come in. So they try to work around the ward, because we don't always get told that someone may be medically fit or being discharged. But what our duty workers do is they follow up as soon as we inform the following day that somebody's been discharged. If we haven't seen them, then our duty workers will follow them up, make sure they're okay. If not, then either we will go out and put services in place, or we will refer to our duty workers if it's a longer piece of work, so that nobody gets lost.
Thank you.
Just to add to that as well, I think it's really important to raise that a lot of people go to A&E and may not end up going admitted into hospital. But from a frailty perspective, some of the work that Andrea's team has done is to dedicate resource at A&E to pick up on people who would be considered frail, to think about how we connect them earlier to support, so we don't see them at a later date where they may be more dependent on that support. So Andrea's team always says there's lots of beds, they're in people's own homes. How do we work at keeping people in their own homes and their own communities for longer? So thinking about those earlier points of intervention and support for people as well.
Thank you.
Thank you very much. Oh, Andrea, could you just put your microphone off, please?
Sorry.
Thank you. Yeah, I'd just like to echo the comments, positive comments that are made. So thank you ever so much for that. And I do love a good chart. So love it. Thank you very much. Thank you for your questions and comments. This now concludes the discussion on this item. I move that the committee notes the delivery of the Adult Social Care Winter Plan 25-26, that we acknowledge the impact of the winter offer on discharge flow and the admission avoidance, and that the committee has reviewed the learning that will inform planning for the 26-27, including the key themes and priorities identified for next year's winter plan, as set out in the report, and is satisfied with the approach being taken by officers. Can you raise your hands if you agree? Thank you very much. That's unanimous. Thank you very much for that. Agenda item 7, Adult Care and Public Health Scrutiny Committee Work Programme. This item is on page 45 to 50 of the agenda pack. This item enables the committee to comment on the content of its work programme. The report will be presented by Chiara Hattiano, a health scrutiny officer. And if you do feel that you need something that you think is really important to you, please put it forward, because what's important to you is important to me as well. So Chiara, thank you.
Thank you very much, Mr. Chairman. So, members, good morning, almost good afternoon actually, from me too. I just wanted to highlight that the work programme, as the Chairman said, which can be found on pages 45 onwards, is a short snapshot of what items are to be expected in future meetings. Now, given the discussion that we've had earlier and under item 4, the announcements, there will be some changes and adjustments in relation to the agenda for the 29th of July 2026, and that is to relieve some stress in terms of the weight of the agenda and the number of the items that we were due to be considering, given the interest of the debate that is anticipated around pre-decision scrutiny items, but also on the CQC report. Therefore, I will be making those changes in consultation with relevant officers, and you will be receiving an up-to-date version with the next agenda pack's iteration. In the interim, please, following the Chairman's encouragement as well, please approach me, be that offline or online, to discuss any items that you would be keen to see being included in the work programme. And I'm already working with officers in relevant service areas to build the agendas from the meeting in September onwards. So whilst you can see that the agendas from September onwards are quite slim in this iteration, please be aware that they won't be at the next iteration of the report. So thank you very much. Happy to take any comments.
Thank you very much, Chiara. Do we have any members wishing to speak? Councillor Cook.
I know we had an extensive discussion at the beginning of this meeting, but obviously it's obviously mentioned that it's going to be at 16th of December we're going to have the item. Can we just ensure that, I think service level performance reporting, I think that's the only other item due to be on that agenda. I think unless there's an exception, can we just keep it to those 2 items?
Yeah, absolutely, Councillor Cook. Can we do that, Chiara, please?
I can confirm that I will make a note. However, the only thing I would like to raise any attention to is any pre-decision scrutiny that might be required around our contractual obligations that I'm currently not aware of. If that is not the case, then I'm happy to keep it down to those 2 items. Thank you.
Okay, Councillor Cook, thank you very much. If there is anything like that does come up, I would call an extraordinary meeting just to try and alleviate that. Thank you very much. Councillor Overton.
Sorry, it's a little bit of an aside. I was just wondering if those visits that we're doing to the homes and so on ought to be a little earlier. I don't know. It's a question, because should they be in the consultation period, or are we leaving it till after the consultation and then we'll have a look? I'm just thinking that maybe we should be thinking earlier rather than 7th to the 9th we look at it and then we come here to debate just after that. Maybe it should be earlier. It's just a suggestion.
Thank you very much. Martin.
I mean, we're happy to work around you. I think we thought that putting it at the timing that we put it would work best, precisely because it would be a reasonably short time before you then were considering the report, and given that the visits aren't part of the consultation themselves, we thought that it would be better to keep them separate. If you wanted to do the visits earlier, I mean the issue is we then get into the summer period, which becomes a bit more difficult. But you know, to a large extent, we are in your hands. We thought that was we thought it made sense, but if there's a different logic that you'd prefer us to apply, we can look into that.
Thank you very much. Does anybody else think, Mac, to have them earlier, or are you just happy where they are? Councillor Redfern.
Personally, I would rather have it when they have been proposed, because of holidays. People are governed by the holidays for the kids, so they've got to go off in August. So, thank you.
Yeah, thank you very much. Right, okie dokie. Is there any more questions? No. Thank you for your questions and comments. This now concludes the discussion on this item. I move that we approve the planned work programme for 26, subject to the considerations that you've highlighted today. Can you raise your hand if you agree? Unanimous, thank you very much. That is agreed. That now concludes the business of this meeting. Thank you very much for everybody for your attendance. Thank you.